Alright, so today we're going to talk about abdominal, hematologic, and some other kind of emergencies. We're going to talk about an acute abdomen, hematologic emergencies, gynecologic emergencies, GI and renal emergencies. 67-year-old Mary began experiencing intermittent abdominal pain and cramping around her umbilicus region several hours ago, but the pain has since become more intense and steady and more localized towards the right lower quadrant. She feels nauseated as if she might be developing a fever. So, how concerning is the patient's chief complaint? Why?
Could be, I think it could be gallbladder.
Does her age play any part in that? You're concerned?
She could get sicker quickly.
What questions should you be asking this patient?
How long has it been happening?
Has it happened in the past?
Pain level?
Alright, what are the steps for physical examination for this patient? You just gonna jump right in, palpate her belly, or?
Ask her where, like, if you palpate it, where it hurts.
Alright, abdominal pelvic pain has many causes and can be caused by serious underlying medical conditions. Care includes managing life threats, making the patient comfortable in transport. Hematologic disorders are disorders of the blood and its components. Regardless of the cause, in any case of abdominal pelvic pain, you must assess for and treat life-threatening conditions. Make the patient as comfortable as possible and get them to the hospital quickly. Alright, the kidneys, ureter, pancreas, and abdominal aorta are retroperitoneal. They are behind the peritoneal lining. The abdomen can be divided into how many quadrants? 4. Alright. The abdomen contains hollow organs, solid organs, and vascular structures. Organs are located intraperitoneal or retroperitoneal. Okay. What does retroperitoneal mean? Behind. Okay. Alright. Here's your 4 quadrants or your 9 regions. Right upper, left upper, right lower, left lower. Left upper contains most of the stomach, the spleen, pancreas, part of the large intestine. The left kidney is behind the abdominal lining. Right upper contains most of the liver, the gallbladder, and part of the large intestine. The right kidney is also behind the abdominal lining. The right lower quadrant contains the appendix, part of the large intestines, and female reproductive organs. Left lower quadrant contains part of the large intestines and the rest of the female reproductive organs. Hollow organs contain some type of substance that might leak into the abdominal cavity if the organ is perforated or injured. This can cause infection very, very fast. Okay? Solid organs are vascular. They contain many blood vessels and large amounts of blood. Some are covered by a thick fibrous capsule. When a solid organ is ruptured or injured, it tends to bleed, and it can bleed a lot. Okay? That one organ bleeding can actually put you in shock. Vascular structures are the large blood vessels found in the abdominal cavity. Portions of the descending aorta and the inferior vena cava are in the abdominal cavity. Rupture or injury to either vessel can result in major bleeding, rapid blood loss, and probable quick death. Alright, the functions of most of the organs contained in the abdomen involve the digestion of food, absorption of nutrients into the body, and the excretion of waste. Alright, you got a table of solid organs, hollow organs, and major vascular structures. Table 23.2, organs of the abdomen and their functions. Alright. Abdominal organ emergencies do not typically create a perception of cutting or tearing. The exception to this is the aorta, in which certain complications can cause a tearing sensation. Alright, that is the hallmark sign for an abdominal aortic aneurysm, is a tearing sensation. However, it has been reported that a tearing complaint occurs only in a small number of patients experiencing a rupture or dissected aorta. With the other abdominal viscera, if an organ is torn, the pain does not result from the tearing of the organ, but the blood irritating the peritoneum, which is the actual lining of the abdominal cavity. Although the pain might not be severe, a serious condition can still exist. This is one of the most important lessons to learn from the differences in the types of pain. Mild and intermittent pain does not mean a mild or insignificant condition. Parietal pain, also called somatic pain, is associated with the irritation of the peritoneal lining. The peritoneum has a large number of highly sensitive nerve endings, so you would expect the pain to be more severe and more localized. It means it's easier to pinpoint with a finger. Parietal pain is more intense, usually found on one side or the other, is sharp and typically constant. Referred pain is visceral pain, alright, that is not felt in the organ itself, but instead is felt elsewhere in the body. The pain is usually poorly localized, but it's felt consistently in the part of the body to which it refers. Referred pain occurs when organs share a nerve pathway with skin sensory nerves. The brain becomes confused in the interpretation of the impulse and causes the patient to feel pain at a location that can be totally unrelated to the organ involved.